to present you our studies, prospective studies of corneal presbyopia treatment. So it is a presby-LASIK multifocal corneal approach. What we do is an addition in the 3 to 6 millimeter zone, in the 3 millimeter zone. It is an addition for the near. That's the issue of this study, to perform this procedure. It is the algorithm is like this. You perform first the normal myopia or hyperopic procedure, and then at the end of the algorithm you perform this 3 to 6 millimeter zone steepness of the 3 millimeter central zone. So that was the last study we performed for myopic patients. It is said myopic patients which were treated with presby-LASIK. There were 72 eyes, and the results were very interesting. You see, already of the beginning, after 1 week, we have already reached a quite very well visual acuity of Lockmore visual acuity of 0.12, and it approaches more to at 0 after 6 months. The non-dominant eye is targeted at 0.5 dioptries as a target refraction. The dominant eye is at 0 refraction. The benefit for these patients are forever in the intermediate distance. We see that for the computer distance, they have a very well visual acuity already from the first day. It is said also during all the time of the follow-up. And for the near, the dominant eye is a little bit less because we put it for the far, and the non-dominant a little bit more for the near. It is a difference of 0.5 dioptries, so they have a quite well visual acuity also during the follow-up. These were the myopic patients. This is orthodynamic with the hieropic patients, we will see. So we also performed this study of the femtosecond laser, femto-LASIK, with for hyperopia of 38 eyes, 19 patients. And the normal inclusion-exclusion criteria as for LASIK are done. And what we have seen that the visual acuity improves during the 6 months. It is said it takes time for the far vision for hyperopic patients. Intermediate visual acuity is very well. Also for the near, from the first day, they have a very high quality of near vision. What we have seen, you have 2 components. You see here we have an overcorrection, that's normal. For hyperopic patients, we have an overcorrection, so in the myopia. So it shifts slowly during the follow-up at more or less 0 dioptries or 0.5 in the non-dominant eyes. So it is very important to explain to patients that it takes time during the follow-up, that for the far the vision increases slowly. For the end, a special case, we have this arcuate incision, you see that. That was in the 18th, so it was really magic. Everybody performs it. But now, these patients are elderly, 16 years old, and have the problem with the shift in the hyperopia with this radiokeratotomy. And the second one is the presbyopia. So we have this patient who's made the procedure in, I think, in Belgium. So what we have performed this procedure with the femtosecond laser, make a LASIK cut. And so we were curious if the cut is very well done. We see that the mobilization's easily. And here you see the cuts in the deepness of the stroma. And now you see we perform the hyperopia correction, and then in the 3 millimeter zone we make a steepness on the central part of the cornea. So she gets a presby-LASIK. What we have seen the first day, okay, we started at 0.3, non-corrected visual acuity, and then it decreases slowly. But it was very interesting to see also very similar results. We have at the end for the far a visual acuity of 0.1. For the intermediate visual distance, a little bit less here on the dominant left eye. And for the knee, it was also quite well. It is 0.8. It's a quite good result, I think, for this patient. If we come to the summary, our study was based on a new presbyopia profile. This new argument creates a multifocal zone without transition zone through the elevation of the 3 mm zone in the center. This center is for the near. And what is also, if you create this correction, you create also spherical aberration. So this treatment should be performed customized. It is said you treat on the same time also the spherical aberration. And the aspherical treatment will be in the 3 to 6 mm zone, and the multifocality is also in this zone. Conclusion for this procedure, our correction algorithms is that dominant eyes is corrected for the far with multifocality, and non-dominant a little bit less in the minus 0.5 dioptry, so that we get the last centimeter for near. These techniques provide spectacle independence, but not 100%, you know. It is the target 95%. It depends also of the profession of the patient. Thank you very much for your attention.